Hi, thanks for tuning in. Today, we are talking about the secret to a healthy and happy life through menopause. So, I'm going to break down what menopause is, some of the symptoms that people experience when they're going through menopause, and let's talk about how to make it so it's actually still an enjoyable phase of your life, right? So, menopause typically occurs, perimenopause, so the time before menopause, that typically occurs in the late 30s through the 40s. So, that can be 8 to 10 years long, essentially. And all that means is that your ovaries are starting to produce less estrogen, less progesterone, and less testosterone. So, these are the hormones that are coming from your ovaries that help the body function. They help regulate metabolism, sex drive, calcium absorption, skeletal muscle development, right? So help us build muscles, help us maintain bone density, help us keep our sex lives good, right? So these are really essential hormones, and they decrease significantly in their output in our body through this perimenopausal period. And then usually you'll have some period fluctuations. So you won't have a regular period. You might have a period and then not have a period for 6 months, and then have a period again, and then maybe a couple months, and then it's gone again for like 8 months. But once you have no period for a consecutive 12 months, then you're considered to be in menopause, and you're actually postmenopausal. So at that point, you've gone through menopause and you're postmenopausal. So there's three periods. There's perimenopause, menopause, and postmenopause. Okay. And usually during the flux and the changes is perimenopause. And then you have menopause once you are fully no period for 12 months. Then you're postmenopausal essentially until the day you die. And so, yeah, that's the progression through menopause. Okay. Typically, you'll go through menopause in your late 40s to early 50s. So you will completely lose your period for that 12 months. And just so you know, if you do um if you do like have your period for you don't have it for like 10 months and then you get it again, then your clock starts over. So then if you are without it for like another 6 months or 12, then you hit 12 months, then that's the official timestamp essentially. So if you don't have a period for 12 consecutive months, then you're considered menopausal. Okay, so before that, you're premenopausal. I hope that makes sense to everybody. But it's just standard medical jargon, and everyone will experience some variation of hormone fluctuation. And so typically, so you might be like, why are you talking about this? Why, like, you're a pelvic expert physical therapist. I own Body Motion Physical Therapy in Edmonds and Poulsbo, Washington. And we help people through this time period. So we help people through menopause. And you might be like, how are you helping people? Like, menopause is just something that happens in the body. And that's what I'm super excited to talk to you about today, because yes, menopause happens unless you prevent it from happening by taking hormone replacement therapy, and some people will opt to do that. Maybe their symptoms are just so severe, their menopausal symptoms, that they will opt for that hormone replacement therapy, or maybe they just want to mitigate going through menopause, so they'll opt for that hormone replacement therapy. But others might, everyone's going to experience this essentially. Like, there's no way around it, right? And some people will experience it earlier. So if you surgically, you have your ovaries removed, or you have a full hysterectomy and your ovaries are also removed. Some people will have a hysterectomy and just have a partial hysterectomy. They'll have their uterus removed, but they'll still keep their ovaries. So they're not necessarily kicked into menopause yet. But if your ovaries are removed from your body, you can be kicked into menopause, and so it's like a surgical induced menopause essentially. And you would be, then you would go through menopause. Okay. And it would be a more of abrupt shift, and not just like this gradual perimenopausal period that happens over 8 to 10 years. Okay. So those are the differences. So you can have abrupt changes or just continual changes. And some of the symptoms that people experience are decrease in sex drive, right? Because estrogen is important in sex drive for women. They'll experience weakness, so just feeling weaker. And that's just not having as much skeletal muscle. So it's really hard to build muscles when you're, like actual guns, when you're in menopause or in this perimenopausal period. And it's because women still have testosterone and they use that testosterone and the estrogen to build skeletal muscle. But when we don't have that, it's a lot harder to build muscle and you have to work hard at it. And the muscle is super important because you need muscles to keep your bones strong. Okay. This is why, like, if you're cardio obsessed and you walk for exercise, that's all fine and good, but you need muscles as you go through menopause and you need to be working your muscles to keep your strength up, to really keep your bones strong. And it's super important because when you decrease your estrogen levels, estrogen is really important in calcium absorption in the body. So calcium keeps our bones strong, right? So if we don't have that hormone that's helping to keep the bones strong and keep the regulation of bone density, so keep the bones strong essentially is like the best non-medical way to say it. So if we don't have estrogen to help us with that, we need to utilize skeletal muscle to keep our bones strong. And that's why you'll start to see, people in their 70s and 80s end up with a lot of hip fractures or different fractures and falls, is because their bones just become so brittle. And so the stronger you are, the more skeletal muscle you maintain in your body, the better it's going to be for aging, essentially. Um, but let's talk a little bit. So I deviated there. And so we talked about, we're still on the symptom track. So you can have a decreased sex drive. Your metabolism is going to slow. And essentially it's, the hormones are important in metabolism regulation, but also because you have decreased skeletal muscle, and skeletal muscle increases metabolism, right? And so, a lot of people experience weight gain as a side effect of going through menopause. Then people experience hot flashes. People experience difficulty sleeping. Other ones are decreased vaginal lubrication, difficulty with orgasms, difficulty with sex or sexual pleasure. Maybe sex is just not comfortable anymore. And they can't tolerate penetration. Urinary incontinence is a big thing. So you might have already had some urinary leakage, maybe when you like ran or jumped or did something or sneezed or coughed, but now it's just like all the time. Or it's just like that much worse. Or maybe you never had it before and now it's like kicking on. And you're like, what is this? Why am I wetting my pants? Why do I have to wear a pad? Can people smell me? Right? Like these are the worries of the symptoms, right? And so, so those are the symptoms of, some of them. There's, of course, a ton more that people experience, and some can be debilitating, right? Like if you can't sleep, or headaches is really common. That can affect your whole life, right? And if you have, and if all of a sudden like your sex life tanks and that used to be like the one fun thing with your partner and now that's tanked, like that can affect your marriage or your relationship. And so it is super important that women talk about this issue of menopause. And I want to talk about some natural solutions that can actually change your menopausal experience and this journey through menopause, because it doesn't have to be like hormone replacement therapy or bust, like you're on this downward spiral, right? And so we want to make this like a good positive journey and not have to rely on medications, because hormone replacement therapy has side effects. If you get medication for your urinary incontinence, that has side effects. Constipation is also, a symptom that some people will experience. And it's like that if you get on Miralax or you're on Miralax for the rest of your life and you're relying on different stimulants, those all have side effects. So we want to, I just said that drug, but really it's like a lot of people get on different drugs and different stimulants or have to rely on unnatural ways to regulate their systems. And anytime we do that, we are going to experience side effects or some form of side effects. And so I want to talk about working with a pelvic expert physical therapist is the most natural way to mitigate a lot of these symptoms that are experienced through menopause. Okay. So let's get started with the number one. Let's talk about some of these symptoms and exactly how a physical therapist is going to help with these issues. And so, you want to see somebody that is specialized in this time period that really just focuses on, you know, female anatomy and really understands this menopausal journey and the shift that happens hormonally because it's extremely, you know, it's specialized. Okay. So you're not going to just like any PT or Joe Schmo or even just any pelvic PT that has, a weekend training course. They're not going to know how to take you on this journey and to make it the most successful journey for you. So do your research. Make sure whoever you see is very knowledgeable about all the symptoms that can occur during menopause and the menopausal journey itself, what's happening hormonally. Okay. And so a pelvic expert therapist can help naturally. So avoid these drugs and avoid your need to use these drugs. And so a couple of the things that we do outside of the pelvis is we'll look at the whole entire body, right? So we can help your joints move with more ease. We can help you feel more flexible, help you feel stronger. And so you don't have to like just wither away, right? We talked about skeletal muscle decreasing. And so if you have a decrease in skeletal muscle, you're gonna start to experience some withering away, right? But you can prevent that. So they can help you on a strength and mobility program that's gonna help maintain your muscle mass and even maybe give you some growth. Okay. Because it is possible, it's just harder. And that's why, but it's essential. Okay. So that is a very important key part of what we need to talk about because you want to avoid brittle bones. We want to avoid osteopenia. We want to avoid osteoporosis. That's the thinning of the bone. Okay. And then that can lead to fractures. Then it's really important to think about other things that a pelvic expert PT can help you with. So if you're having all of a sudden sex is uncomfortable or you're gritting your teeth through the experience and penetration, you just can't tolerate it, or deeper thrusting, you cannot tolerate it, or you are tolerating it, but it is not fun anymore. And that would be a time that, like, okay, let's look at this tissue. What is happening with this tissue? Well, let me tell you my experience. When someone goes through menopause and you have decreased estrogen, decreased progesterone, you also have a decrease in lubrication that happens to this area. So the muscles themselves, you can also have decreased blood flow, and the muscle themselves end up getting tighter and tighter. And then you have people go and do Kegels, right? Like they've been told by their doctor, do your Kegels, or they're, sitting on these chairs that are popular now to help them be continent. And they're getting tighter and tighter in their pelvic floors. Therefore, that's decreasing the amount of blood flow because a healthy pelvic floor should relax and contract, but then they don't have the ability to relax anymore. So they're getting more stuck in this tight position if this was their pelvic floor. The muscles dehydrate and the muscles become more like beef jerky. And we want a healthy, happy muscle to be like an uncooked steak or chicken breast, right? That is a juicy, healthy muscle. So that's our goal for the pelvic floor. We want those muscles to be juicy and healthy because when they're juicy and healthy, penetration feels good, sex feels good, orgasm is possible. Okay. And so, therefore, you experience sexual pleasure. But if you don't have that type of muscle and you're starting to go more towards that beef jerky muscle, it is really hard for that beef jerky muscle to contract and relax. And you can just the thought of beef jerky, right? It would feel rough in the vaginal canal. Okay. And so it's really important to treat this muscle and treat the pelvic floor itself, treat the whole pelvis itself, because we want to improve. We can improve sex. And just treating that not only just improve sex, it can improve constipation, it can improve urinary incontinence. So you're not leaking, you're not worrying about all the urine that, you're not worrying about having to keep it in your pants, right? So it's like you don't have to wear diapers, you don't have to wear pads because you're treating these areas. So the most joyful thing I can tell you though is when you start to treat this area, a lot of times your hips will feel looser. You're going to feel more mobile. You're going to actually start to feel stronger. So, this kind of treatment isn't just prescribing Kegels. It is absolutely, honestly, the opposite. It is not Kegel therapy. Pelvic floor, pelvic expert physical therapy is treating the entire pelvis and really the entire body so that your muscle, your pelvic floor, doesn't just contract when you sneeze or cough. It has a natural recoil, almost like a slinky, and that's how you want all your muscles to be, but that's especially what you want your pelvic floor to be, is when your foot hits the ground, you wanna have this natural recoil that your pelvic floor just kinda contracts on its own. You shouldn't have to think about doing a Kegel or a contraction. So, a pelvic expert physical therapist will work on your pelvis and will work on your pelvic floor with manual therapy techniques, with exercise techniques, with visceral mobilization techniques, which is like moving your organs around to make all of this healthy movement happen within your body. And that will improve the blood flow, that will improve the quality of the tissue, and then it makes your core that much stronger, which is like really honestly the coolest thing because when your core starts to get strong, that can save you from a hip replacement. That can save you from low back pain. That can keep you walking longer and keep you, in your exercise programs. And so you're not going to become, the 70, 80, 90-year-old in the nursing home that is in a wheelchair, right? Because like essentially we want to all avoid that, right? No one wants to be bound to, not being able to move their bodies and, succumbing to low back pain for the rest of their lives. So they're stuck in a chair or a knee that won't hold them up, right? Like we want to keep our bodies healthy. And it all starts with really what we do after babies, but it can really start after menopause or really in menopause. And if we can help improve the health of the tissue of the pelvic floor, you will affect so many symptoms through menopause and you will feel that much better that by the time you're in your 80s, you're going to be the most supple, vibrant, 80-year-old that you can be and keep up with your grandkids and your great grandkids and whatever that looks like for you. So, this is my little episode on menopause. I wanted to talk about it. I want to get it out there because we don't talk a lot about menopause. If you follow our business at all, we talk a ton about fertility because we help people through the fertility process and infertility process, helping them conceive. And then we help through the childbirth process, improving their delivery outcomes and their pregnancy experiences. And we also help with postpartum. And let me tell you, postpartum is like a mini menopause because as you go through that postpartum period, right after pregnancy, your hormones significantly drop. And when you're breastfeeding, they stay dropped for a significant period of time, usually around 18 months, or until you cease breastfeeding. And then it's an additional 18 months. And so that's like your little glimpse into what menopause can look like, essentially. And so, if you can start then, because the sooner we can get these tissues healthy after baby, the sooner that we will, keep them healthy through menopause. But for anyone in menopause, the sooner we can help you, the sooner like you're gonna notice these changes right away. And these changes are magical. And these changes will help you sleep better. These changes will, help you move your body so you're not feeling all the discomfort and help you, improve your metabolism because you're doing all of these things with a pelvic expert physical therapist. And so I hope you can find someone in your area. If you can't, reach out to us. We have an intensive program where people travel to Washington and they stay in a hotel for a week, and we do whatever their body needs, an intensive therapy session every single day for a few hours a day to 4 hours a day, just depending on what you need to really help get you ready and thrive through this menopause experience. So I hope this was helpful. And we look forward to seeing you soon. Take care, guys.